Oh, I don't know if that went to his neck or to his ear. Animals instantly go to the neck. I've seen people come into the ER attacked by dogs and they're missing muscles that normally you would just see in a cadaver lab. Oh, nice. Out cold. You see that? You just knock somebody in the right spot, lights out. Hey everyone, Dr. Jordan Wagner here, board certified ER doctor. Today we're going to take a look at some takedowns and executions from the Call of Duty franchise. I don't know what I'm getting into, but I know there's going to be blood, guts, and a lot of bullets. Let's take a look. Ooh, takedown, obviously, however you get them down to the ground, but you're going to the neck. You got your airway there, you got vascular structures there. You can incapacitate somebody pretty easily. And it is a pain to fix, right? You have big holes in somebody's neck that you're just gonna bleed out through basically a hose. You're gonna die pretty fast if you bleed out. If the person's aware, they can just stick their finger in that hole, tamponade it off, and hopefully run away. But in these situations, you're also getting destroyed by your assailant anyway. Blunt force trauma to the head with a hammer and then right to the face. You can get cervical fracture on that type of wound. You get facial trauma, you get your face smashed in, right? There's the myth that you can get your nose smashed in and it goes into your brain. If you can get shards of bone that go into that area, obviously not gonna kill you right away, but it can cause a lot of damage. All right, we're just getting blunt trauma to the chest. You can cause some fractures potentially with that type of force or dislocations, depending on where you're hitting. It's gonna hurt your hand a hell of a lot too. If anybody's gonna be punching anybody, please make sure you punch somebody appropriately. You hit somebody with the first two knuckles, not the last two, and those are just gonna snap super easy. So when you're coming around, just go straight for the person or you're gonna fracture your hand and then how you're gonna continue to fight. Oh, got it, cervical fracture. So if you get a high enough cervical fracture, right, you're gonna stop breathing. There's an adage, 3, 4, 5, keep the diaphragm alive. It's part of your phrenic nerve, which comes out of the cervical nerve roots of 3, 4, and 5 in your neck. So anything above that area, you're gonna basically prevent somebody from breathing, and that's basically one of the ways that you're gonna die. Nice. 3 impaled wounds, right? You got your spleen on that side, so you can go some damage there. If it's a long enough knife, you can hit the heart, you can hit the aorta on that side. Depending on what you're hitting, it's gonna cause minimal damage or a lot of damage. And then the last wound right into the back of the neck. If it's a sharp enough knife, you can go through bone and sever the spinal cord. You could probably be able to do that. I put a spinal needle in between the spinous processes of people's backs to basically do a lumbar puncture. So you can get in there with a knife too. I like the moves. Holy cow. It's pretty impressive the way you'll be able to move the knife. Good wound right into superior to the clavicle on the left side. Right underneath this area, you have major vascular structures. That's why we're made to have cages to protect all the major organs and vessels. If you get those ruptures, there's no way to push pressure onto these wounds. You're just gonna bleed and bleed and bleed. And there's only so much blood that we have in our bodies and eventually gonna die. Oh, nice. You're going right into the right side, major vessels. You got arterial bleeding going on into zone 2 of the neck. Remember zones 1, 2, and 3. Zone 2 always needs to go to the operating room no matter what. You're gonna bleed out and you become euphoric. You're gonna have decreased oxygen to the brain, but you're still getting blood flow to the other side and your heart's still pumping. So things are still gonna happen. You could probably fight back, but you're gonna start losing energy pretty fast. Slice, soft tissue injury, and force right to the face. Depending on where you're going in, you definitely can put a blade into that amount of force, that sharp of a blade, through the different soft tissues of the face. And there are different arteries that go into the face that can actually bleed like that. There are branches off of one of your external carotid vessels. Oh, that's messed up. You got major vessels down there in the groin too, besides causing a person pain, right? These are trained people to hit where all your major arteries are. Your femoral artery on either side, just at the groin. Protected by some structures, but you hit them, it's gonna cause a lot of pain and you're gonna bleed. Oh, nice move. And cervical fracture. Cervical fractures are totally survivable as long as the spinal cord isn't injured. So if it gets severed, or you can have what's called the shringomyelia, which is basically injury and there's blood going down the middle. There's all these different pathologies that can happen to the spinal cord that can cause stroke-like symptoms, paralyzation, huge gamut, besides just death. Oh, nice. I don't know where a creature of death comes from like that, but destroying somebody's head and ripping it off. Obviously, if your head's not attached to your body, you're dead. We all know that. There it is. Oh, what is this thing? No chance. Head's gone. Animals are trained to go to the neck because they know that's where all the major vessels are and it's easily accessible, right? Puncture wound to the neck, down to the ground. Incapacitated, probably not dead. Obviously, all those major vessels, got to worry about. So, right lower side, what does a guy have on that right lower side? You got mostly intestines. The issue ends up being with that is bleeding and then infection later if you survive. Any of these puncture abdominal wounds, you come to the emergency department. One, you get stabilized, make sure you don't need immediate resuscitation, you don't need immediate intubation, major IVs put in, huge ones, so you can just dump fluid in, and then you're going to the operating room. You're having an exploratory laparotomy, basically where the surgeon is going to cut open your abdomen and explore and see if there's punctured bowel or lacerated bowel you need to get washed out and put back together, and then make sure no major blood vessels are injured, and if that's the case, they need to put those back together. I love this instrument of death. It's awesome. Those are going deep enough, a wide wound, a lot of force to be able to put that in. And of course, the left chest wall is low enough that it's mostly going to be rib and lung injury. I've seen people where you've intubated them and you're breathing for them and the air is just shooting directly out of the hole that was already made. Oh, it's like a massive axe. Again, in the back, you got your scapula. So the amount of force that it takes to fracture those, you're gonna have major trauma to the inside. And so those are always a high suspicion that there's something else going on. So same, obviously if the axe goes through, you're having massive injuries. But if you fracture those bones, we go even further to make sure that there's no further damage on everything else that could be in that area. I like this massive hammer. I don't even know what type of hammer that is or what instrument, but the amount of weight on that, the more weight that you can swing around, that's going to cause a lot more destruction. Not going to cause immediate death unless you're having brain bleed from the traumatic brain injury. And you can actually even have what's called an axonal injury, where people get it even where you just become altered, amnestic, you just don't remember any of the events. And even sometimes it's permanent moving forward just from that amount of trauma. Boom. Nice. So the compressive force, besides fracturing the skull, you can fracture the vertebrae in the neck, which then causes explosion of the vertebrae, which then you have a chance of severing the spinal cord or having pieces of the bone into the spinal canal, which then again potentially is a neurosurgical emergency to have surgery to get that stuff fixed. Oh, nice. Unconscious most likely versus like death in that situation, but that's what you want to do. Basically move on and get to the next level of the game, I'm assuming. Oh, we got a dog. Animals instantly go to the neck. Dog bites, animal bites, they have these huge canines, right? These big teeth that just puncture and then they grab and rip because they have just such good force. I've seen people come into the ER attacked by dogs and they're missing muscles that normally you'd just see in a cadaver lab. Incapacitate the leg, get him to the floor, and then open season on the neck. You got all this body armor. You know, you can try to go for limbs, but that's not going to incapacitate somebody. You're going for the neck. Oof, right to the Achilles tendon. So you knock off your Achilles, which is the tendon that attaches your calf muscle basically to your heel. You can't flex off. You won't be able to walk. You can kind of limp around on it, but only if you keep your leg structurally straight. It's pretty painful, and it's just flopping there. Your ankle's just in the wind. Oh, nice. It's like the John Wick style, like close contact, gunshot wounds to neck and face. Those are so close you're even having burns from the explosion of the bullet itself. That's not coming to the ER. That person's probably dead. Nothing like some cinder blocks being chucked at you to cause traumatic force, brain injury, blunt head injury, and potentially fractures. Oh, nice. Sharp knives to be able to cut through potential Kevlar vest, but you got lacerations on the side of your body. It's gonna be soft tissue. Your ribs are protecting you. Your hips are protecting you. Potentially, it's just bleeding out of some smaller blood vessels within the soft tissue. You're not having any major vessels on the sides over there. Nice. Penetrating trauma right to that chest. The cuts to the sides of the body, again, they're just gonna hurt, but penetrating straight through, if you're getting past the sternum, which I've seen before, if you don't hit the heart, you can hit the sac around the heart, you're gonna get blood to fill in the cavity, and that's gonna compress down the heart, basically causing pericardial tamponade, potentially dislocating the shoulder at that point with basically that type of force. That's actually weirdly a type of technique to put it back in. We don't do it too much anymore because if you put your foot inside someone's axilla, the armpit, you can cause nerve injury because there's something called your brachial plexus. So if you're pulling on that, it can cause injury. So you can do it a lot more gently. And if you pull too hard, you can then cause more fractures basically of the glenoid rim, which is part of the scapula where the shoulder joint is. Ooh, ooh. A single gunshot wound to the head, again, depending on which structures are hit, will depend on instant death versus brain dead. I've seen people not take potential bullets to the head and live a long time with a meaningful life, but I've seen people take puncture wounds through the skull as well as like nails into your brain and still able to live a relatively normal functioning life. So that type of baton, go into the back, dislocate ribs, potentially fracture the vertebrae, and then actually not just the vertebrae, the ribs. When you break a bone, those fragments of bones are super sharp. You can actually get a punctured lung from the bone itself puncturing into the tissue. And you can actually use them as weapons. Like Indian culture, they're using bones and they're shaving them down. They're just super strong and they can be super sharp. Oh, oh. I don't know if that went to his neck or to his ear. If say you get punctured through the ear, you have basically a couple little structures in the ear itself and then straight to, you have some dense bone, but then it's going straight into the side of your brain. And actually if it's in the ear, it's kind of low when it comes to the brain itself. And so you're getting into like the midbrain, you could potentially cause a lot of injury and pretty quick death if something's injured down that low. Oh. Finally, I got some good blood splatter. A lot of these injuries, they're hidden, which in real life, it's not as exciting, so to speak, as a video game, but we obviously have to see what's going on in the video game. But you're not getting a major amount of splatter, you're just getting more blood leaking out, and you see pooling. So a lot of times that's even a good move, basically. You stab into the neck, but then you actually are rotating and ripping the tissue. I have people come into the ER all the time where they lacerate something with such a sharp precision tool that it just reseals itself. Versus if you have a nice sharp blade and then you rotate and rip through, then how you're gonna be able to close that off and seal it back up. A lot of protective tissue actually in the axilla, you got a lot of muscle, but there's all those major vessels and nerves of your arm. So you can injure the blood vessels and then you can incapacitate the arm itself and the arm won't work. But then you got to continue the moves because the arm won't work, but you still have another one. Oh, nice. Person's pretty much knocked out more from the blunt force than from the actually bleeding laceration of that. Out cold, you see that all the time. You just knock somebody in the right spot, lights out, and it all depends on when they wake up. Holy cow. That was nuts. The theme of that was neck injuries, neck wounds, right? Gunshot wounds to the face and the neck, and then a blade hitting the carotid artery, hitting the jugular vein. That's how you get to kill somebody in these games and actually in real life. If you guys want to see more videos like this one, check out Gamology on YouTube and Facebook, and check out my channel at Dr. ER and Doctor Jordan Wagner, DO. Thanks for watching. All that stuff in the ER that's going on, it's not happening in like this step, then this step, then this step. Probably takes about 3 to 5 minutes to get all of that stuff done. Tubes in the throat, into the chest, getting O negative blood into the person, controlled chaos.